We're talking about health and wellness. We're talking about biohacking. We're talking about mental health. And Dr. Choulet, you are the Phoenix Suns psychiatrist consultant. What's your exact title for the Phoenix Suns?
I am the team licensed mental health professional and the consulting sport and performance psychiatrist.
And is that do you get a lot of playtime? Like, are the players coming in your office like all day?
I like to say I make myself readily available. So then if there are needs, then I'm there to chat with them. But yes, I work a lot with players, staff, anyone who needs help within the organization.
And when you meet with a player, is it mostly like, do you do it at the arena or at Footprint Center or at that practice facility in Arcadia?
Really, all of the above. So I'll meet with them at the practice facility, at the arena before games, at my office, in their home, or virtually. So any of those five.
And is it on the down low, or do the other players know that, oh my God, you're meeting with Brooke today?
It is on the down low, I would say, mostly, except for like if it's before the games and they just finish warming up on the court and they're like, hey, can I grab a few minutes? So we're just sitting out there on the court chatting. So that is public, and I only do that when they initiate that publicly.
Okay.
Yeah.
And what about when a player gets traded? I always thought like watching the emotional roller coaster, or that there would be emotional roller coaster being traded. Do they ever continue talking to you even though they're with another team?
That is such a tough question because clinically, we can only practice medicine in the states that we're licensed in and where the patient's located. So let's say we trade someone to Memphis. Now I'm not licensed there, so I can't continue clinical kind of care with them. But what I can do is just be a person and just check in and be like, hey, this was a really tough time. We miss you here. How's it going? And just like be a human with them.
They can't call you and do service that way?
They can call me, but again, for that more like casual conversation, it can't venture into like a clinical patient relationship again since I'm not licensed in that state.
So how long have you been with the Phoenix Suns?
I've been with them for 3 seasons and with the Mercury for 2 seasons.
Okay.
Yeah.
All right. So we had like a bunch of things we want to get into, right, Carrie?
We do. We absolutely want to talk about some of the issues in mental health. Not really as much as what you do day in, day out on the regular mental health side, but some of the ideas that the players might go to, or they might search something on the web that says this is a cool new trend of something that can help me get better. So we specifically want to ask you about the use of ketamine. And ketamine is a drug that has become pretty common in the mainstream market for people helping to deal with clinical depression, anxiety. We know players deal with a lot of performance anxiety, which is why you're helping the team out. And what has been your thought process on this new rollout of an old drug? Ketamine's been around forever. We used it in the emergency rooms to help sedate mostly young children if we were doing an invasive procedure. But ketamine has been used now to help people overcome the barriers with depression and with generalized anxiety disorder. What are you seeing happening with, specifically in the NBA? Is there any use, or is that a allowed drug for the players? And what has been your take on that?
Yeah, I think that it's really easy to get caught up in what seems to be the newest fad of things. And in the NBA, especially when we have players that are performing at such a high level, it's so critical to make choices and medical interventions based on like the most minimal side effects possible. So to me, like that is like the very end of the conversation and should not even really come up because ketamine, just with the general population, can have so many potential side effects. So much so that at a place that's doing it well, you're monitored for 2 hours after a Spravato nasal spray. So I think that it's something to keep in mind, especially with NBA players and especially in sports psychiatry training, is like what intervention can you have that's evidence-based that has the least amount of side effects possible.
Can you help the listeners understand more about the drug ketamine itself? Because this falls within the psychiatry realm to some extent right now. It wasn't originally developed for that, of course. It was more of an anesthesia medication. But psychiatrists have embodied it and found new applications for it. So what has been some of the literature, what has been some of the medical studies that have been done around this drug and using it on the psychiatry side?
Yeah, so I think it's been studied for a few different things, some for PTSD, some for depression. And recently, the FDA, when they approved Spravato, they approved it as the nasal spray for depression with an antidepressant, which is interesting because they're not saying you should just go use ketamine without evidence-based pills that are already available, they're saying that you can use it in conjunction with antidepressants. So in the study that was done that the FDA had cited in their statement for Spravato specifically, it was seen to have superior efficacy when compared to a placebo nasal spray with an antidepressant compared to the Spravato plus antidepressant. So that did have better efficacy in terms of treating depression.
Isn't it an IV drip?
The
ketamine?
Spravato, so ketamine can be given IV, IM, and then Spravato is the nasal spray as well.
Spravato is ketamine?
Is esketamine, yes.
As a nasal spray. But what you're referencing is most people are actually seeing the clinics pop up as an IV drip.
Like, I talked to a guy yesterday, and I think he's a pretty clean guy. And he goes, "Oh man, I got to tell you about this ketamine drip I did." Yeah. He goes, "It was amazing. He was like, I was spinning. I was out of control. It was like I was high." And I don't think this guy drinks or does drugs. Then I have another buddy of mine who is pretty healthy. Well, he's a fitness guy. And he was like, "Dude, I got to tell you, I did ketamine. And it was he's done every drug in the world, right?" And he's like, "And this made me never want to do drugs again. It was so amazing." And I was like, "Well, I don't do drugs, so I don't need that feeling." And I remember right after that conversation, Carrie, I went to you. Carrie's my doctor, by the way, my real doctor. And she was like,
Not the fake
she was like, "Don't, stay away from it." Then I watched this documentary, and actor David Arquette, who's been on every drug in the world and addicted, he goes for these ketamine treatments, and they show the ketamine treatment, and it did not look pleasant seeing what he was going through. So now I'm like, this is coming up all the time. Why are people doing it? Like non-athletes.
Yeah, I think that people want a quick fix and they want something that will act fast and give them a high when they think it's medically indicated. And so
It's
I
a
think,
high? It's like a, like what?
I
Like
can't speak to that. I've never tried it, nor have I had my patients try it because I don't recommend it. But I just go back. I'm so conservative in how I practice, but I just go back to like evidence-based medicine. There's so many other options we could try before we even start talking about some of these other things, including things that are more studied like TMS or ECT for very severe treatment-resistant depression. So sure, there's some utility possibly, and maybe if you do it in the right setting, but I have never referred a single one of my patients to go get ketamine.
So is it an NBA thing? Are people in the NBA doing ketamine, or is this just?
No, people in the NBA are not doing ketamine.
Okay, well
That's good news.
Good, we're making progress.
Yeah, and psilocybin as well is a prohibited substance in the NBA.
So for people who don't know what psilocybin is,
Yes, that is like magic mushrooms.
also
Yeah.
banned.
Also banned.
But
Yes.
marijuana not banned.
Marijuana not banned, synthetic marijuana banned.
What's that? What's the difference?
So I'm not a marijuana expert because I'm also anti-marijuana. So I'm not the person to ask about the synthetic
Okay.
So
versus.
just synthetically manufactured versus deriving it from the plant.
Like when you go to these places everywhere that sell it, that's normal marijuana, like the plant behind you,
Grown.
Carrie? No, I'm just kidding. Like synthetic, that's not gummies. That's not.
No.
That's
I
real
know
stuff.
you're talking about synthetically manufactured, pharmaceutically manufactured.
Okay.
Yeah, they're chemically making.
So the normal marijuana is legal in the NBA.
So I wouldn't say it's legal. It's not on their prohibited substance list.
Okay. Because there is a very well-known NBA player that was pushing this and talked about doing it all the time. In fact, I have two sons that play basketball, and I didn't want them to watch that clip because, they're very, what's the word I'm looking for? Affected, or they influenced by players in the NBA and things that they do. If so-and-so's got a pair of shoes, they want that shoe. If they see a very well-known player that might play for the Suns talking about smoking weed before and after games. In fact, there's one player on the Suns that I heard, he's not on the Suns anymore. There was lots of complaints about him that from the people I knew because he wasn't training hard, he wasn't working hard. And they said he smoked weed all the time. Like, to me, that seems like a big side effect because isn't marijuana a depressant?
Well, people react differently to marijuana. Some people, it makes them extremely anxious, paranoid, jittery, and for others, it can just make them totally apathetic.
Neither of those good.
Yeah,
in
neither
playing
good.
sports.
So why do
Yeah.
players want to smoke that stuff? So then there's no benefit to being a better athlete on it, is there?
Well, I think that people think that in the short term, it can help with anxiety and depression. So yes, that may be true in the short term, but there was a study I just read this morning, actually, that when they looked at marijuana use in PTSD, in the short term, it was seen to have some benefit possibly, but in the long term, for long-term users, there was no benefit and they just developed a greater dependence reliance on it. The other interesting thing to note too, in terms of young players or teens that are non-athletes, is that the American Psychiatric Society actually put out a statement about marijuana in adolescence, because if you use before the age of 25, when your brain's fully myelinated, it can have lasting effects on your frontal lobe, which kind of develops like your executive functioning, how you make decisions, your impulsivity. So it can actually have negative effects on your frontal lobe development with marijuana use before age 25.
But then you see these players playing great, getting $100 million contracts. And one of the things they talk about is smoking marijuana. Kind of bums me out as a dad. You know what I mean?
Yeah.
So I'm going to shift gears on a couple things, if that's cool. We're just going to jump around, right? Be all over the place. So I've been looking for someone in your field for a long time, for personal use for my, I have 3 boys. 2 of them are basketball player athletes. And my middle son, who plays basketball in Hawaii, we would go, when he was in the AAU program, we would go on these long drives, and I was always listening to a book or something motivational. And I landed on a book written by a sports psychiatrist or psychologist, I'm not sure. And I thought it was one of the most amazing books I've ever read in this field. So you're the only other person I've talked to in this field outside of this guy, who I've never talked to. I tried to track him down, and I believe he passed away. And now I can't remember his name, but the book is called Mind Gym.
Okay.
Have you heard of it?
I have not heard of that book, but I've heard the term mind gym actually used in Formula One medicine. So they developed a physical gym, and obviously for physical strength and conditioning, and then a mind gym that's just as big as the physical gym. So Formula One medicine has a physical gym and a mind gym. And in the mind gym, they have different modalities that are available, like things that can help your mental resilience, cold plunge, mindfulness practice, meditation, things like that. So that's where I've heard the term mind gym.
Oh, well, if you get a chance, the guy was in Arizona. Like he was this guy that had the Cardinals, and he had all the baseball teams. He was the football player Cardinal guy, and he was the guy for a lot of all the spring training teams that came here. And he would tell all these stories about working with players mentally, like how, you hear like The Secret. Like I think the foreword of the book is by Alex Rodriguez. And he goes, every night when he was in high school, he'd go to bed, he'd lay in bed, look at the ceiling and say, I hit the ball hard, I hit the ball hard, I hit the ball hard. And he had his batting average. He would say his batting average loud over and over and over again. And the guy goes on to be, World Series champion and gets all this stuff. And so he's in the book. A couple football players from the Cardinals are in the book about having a positive mindset and manifestation. And like, where are you on that?
I think that's so critical. So in a lot of the mental skills training for athletes of all sports is that positive, they call it positive self-talk. So it's like affirmations, habit building. I think like to that, habit building is so important for these players that, there's so many NBA players or just basketball players that are great athletes. But what makes like the LeBron James, Steph Curry's, what makes them different is also that mental resilience and that kind of immediate decision-making ability in a game. So how can you hone in both the mental skills part of things and the physical skills is partly by doing things like that positive self-talk, verbal affirmations, guided and visual imagery. Those all play a big role in really differentiating those that excel.
So you say a visual imagery, what exactly do you mean? Like, do you have an example?
Yeah, so an example would be like a 5-minute guided thing, maybe talking about, imagine yourself in the locker room, you're just about to go out on the court, you can feel the positive energy of your teammates, you see yourself taking your first shot, and it's literally guiding them through a positive and a successful encounter in the game.
Is that something you say to the guys on the Suns if you're talking to them?
That's one modality I use for those that are interested in pregame kind of guided imagery. Yeah.
Yeah, because I would tell my sons, I'd be like, visualize. Like when you go to bed at night, you see you walking on the court, you see the ball going in, you see everything ahead of time. And then I watched this documentary called In Search of Greatness. If you get a chance to see that, it's amazing too, because that's where like you have Tom Brady, the greatest quarterback of all time, the greatest quarterback of all time. And he, at that combine where they measure you, he's the worst performing ever, right? Now he's the greatest quarterback of all time. But at this combine place, he was the slowest, he was the most out of shape, but he's the greatest quarterback of all time. So the documentary goes on to say, we measure things because we can measure them. I was talking to you about this the other day.
We were talking about it the other night.
Yeah, I was like, because it's like, just because you went to Stanford doesn't mean you're the best doctor in the world, right? So here's Tom Brady, who is the best quarterback of all time. Why is he so great? What is it? And he talks about motivation. Same with Muhammad Ali. Same with Jerry Rice. He's like, Jerry Rice said he would go to bed and throw a football in bed every night, and visualize every single game. Before the game happened the next day, he had it all in his head. He saw everything. So did Michael Jordan. So I feel there's got to be something to that.
Yeah, and what's really interesting too is like at what point does it become unproductive? Like I talk a lot about with people unproductive versus productive anxiety, and a productive anxiety is something you could do something about. So like, oh, I'm worried about my SAT score. Okay, well you could study more. Whereas an unproductive anxiety is, oh, I'm worried I'm going to get cut from the team. Well, there's nothing you can really do about that worry, and it's derailing your performance. So I think it's important for people to change their worries into productive worries and then act instead of just sitting with the worry.
Oh, that's good. That's really good. How about athletes that suffer an injury, coming back from an injury?
That's a mental game.
It is.
is?
It's, yeah, a lot. Because, you know, especially at the start of a season, for example, let's say you get a big injury, you've mentally prepared all summer to be able to get back out on the court and potentially win a championship. And now you get a season-ending injury. That's devastating to a lot of athletes.
It's devastating, and that what if is still in the back. They know they have a weak link in their armor, right? They're going to go out, but in the back of their head, they're constantly trying to battle this issue of what if I go down again? And it's, even though physically we tell them you're 100% back, you're 110% back, you're even better than you were, they go out there and they play as if that injury is still there. And that's a well-documented issue with players coming back. And that's something that I think definitely psychiatry gets more actively involved in to try and help them work through the performance anxiety, because that's where it shows. Coming back off an injury and teaching them how to act as if, you know, you're talking about throwing the football 100 times, you know, envisioning the game. We're trying to tell them to go back out and act in their mind as if that injury never occurred, because they keep replaying the injury over and over again. in their
Yeah,
head.
like my kids, my son who was hurt, he won't watch. You know, there's a couple of famous injuries on video of ball players, right? Paul George broke his leg. And he's like, oh, check it out, Paul George broke his leg. I don't want to see that. I don't want that in my head, right? But so you're saying, so you train like you never had it. Pretend you never had it. You never had the injury.
You have to get them to train as if they never had it. And that's the hard obstacle, because it's really deeply imprinted. It's a form of PTSD almost for that player. So you've got to find a way to overcome that and really get them to believe they truly are intact. They are uninjured at this point. And they may actually even be stronger than how they went, you know, how they got injured in the first time.
That's what I heard. Have you been to her facility?
I have. It's beautiful.
Right?
Thank you.
Like the athletes that go there, like I think you go to a hyperbaric chamber like she has at Venice Air, and you come out better.
Yeah.
And you know, to keep doing it. And I watched this documentary on this hockey player, Connor McDavid. Did you watch it?
I did. Yep.
Yeah. So this dude tore everything, and they were going to have him have surgery. He didn't want to do the surgery, so he went into hyperbaric every day, 2 hours for 45 days straight.
Wow.
And then he did these MRIs, and you just see the ligaments all starting getting
That's
back together again,
incredible.
right? That's crazy. Also peptides,
Avoided
I think.
surgery, and came back to have his best season ever.
Yeah, he signed a $100 million deal at 23 years old after his injury.
That's amazing. Right. One thing that I'm trying to bring in more to light is that there's so many physical indicators of when you can get back to your sport, right? Like you go through physical therapy and they look for certain markers and mobility and measures and force and strength. But one thing that is just starting to be introduced is psychological readiness to return to play. So that's a big thing in sports psychiatry world that I've been diving more into recently, is what measures are there to validate or measure your psychological readiness to return. And what I've found is that kind of dividing injuries based on length of injury. So like, okay, if your injury timeline's 1 to 2 weeks, it's not as detrimental as like a 4 to 8 week or a 12 to 16 week. And so what are questions that we can ask that are validated and studied that measure your confidence and resilience and confidence in yourself to get back out on the court, and not using that as prohibitive, like, oh, your score was a 40 out of 100, you can't go back, but using that as an indicator of where are the weak areas, like what would get you from a 40 to a 50 in confidence. Because if we can identify those steps, then we'll have a better likelihood of you being more successful when you get back out on the court.
So you have that already, or you're working on that?
We have implemented that already this season.
So like what are some questions you ask to find out if they're okay mentally to come back on the court after an injury?
Yeah, like how confident are you to take your shot that you would normally take on a scale of 1 to 100?
But
And
will they
there,
be honest with you? Because
Yeah,
I
that's what
think
I was gonna ask.
I think
How
they'd be
honest-
like, yeah, 100%,
I gotta get
100%.
back.
But really, how do you know you're getting?
well, I think I always like say ahead of time, like your score is not going to determine if you're going to get back out on the court or not. The physical rehab side of things is going to determine that. So like, let's just have real conversation and this stays internal. So any conversations I have with players or really anyone is confidential. So if they talk to me and can be honest, it could help their performance if I can help them identify some areas where they're still feeling uncomfortable and work towards those.
So let's say I had a hurt oblique, tore my oblique. And now I'm ready to come. I feel like I'm ready to come back. Like, what would you ask me?
Yeah, so the goal is that every week during your rehab that we would be checking in and going through that same 7-question scale. And so then I could measure your progress. It's not just like, okay, you're ready to go back out on the court. What's your
And
measure
then
today?
you would give him homework, essentially goal-targeted direction that would help him go back and kind of revisit why he's hesitating, feeling
Yeah.
anxiety towards going back. It would help you guide exactly what modality, if you will, that you're going to give him to work on.
For goal setting, I like to try and get them to set their own goals first before I never want to try and tell someone what I think their goal should be. So I just try and work with them on goal setting. I just facilitate their mental exercise of setting goals for themselves.
Have you ever had a player that you worked with where the physical medicine team said, okay, they're ready to go back, let's push him back out there, and you've had to pull back and say, he's not ready to go, he's going to get re-injured? Has that ever been a problem?
Not yet, because the psychological readiness to return we've just implemented this season.
Okay.
And it's quite early in the season still.
So how can you walk us through how you became the team psychiatrist for the Phoenix Suns? Like, was there a job opening posted on?
Oh no, I
some-
don't.
It
I
was
don't
on
even
LinkedIn.
think-
Yeah, I'm just wondering how that
So
works.
what's interesting is that the league mandated this, I think back in 2019, either 2018 or 19, that teams had to have both a consulting psychiatrist and a licensed mental health professional, and that
It's not
could
the same
be.
thing?
No, so that could be a social worker, it could be a psychologist, but then regardless, they had to also have a consulting psychiatrist. So us and 2 other teams are the only teams that actually have the psychiatrist in both roles that does the therapy and the med management. Most other teams have like a therapist and psychologist, because I think in a lot of areas, the consulting psychiatrist is affiliated with whatever the team sponsor is. So like in town here, it's Banner Health. So out in Utah, like the University of Utah is the consulting psychiatrist, but they have their own in-house person. So here we're unique in that I provide both, and I'm in private practice and have the time to really dedicate to both.
So when you go to work, you go to your private practice, or do you get up and you go to Footprint Center, or you go to the practice facility?
I get up and I go to the practice facility. I'm there until about 1 o'clock, and then I'll go to my office.
But you get there what time?
I get there around 8 a.m.
And literally, you get there at 8 a.m. and like, there's someone at your door. I need to talk to you.
It's so strange. Like I try and explain this to people all the time. I'm like, okay, so I get there and like I'll go up in the breakfast area and I'll just sit and work and make myself available. Because the number one thing with professional athletes and on any team, any sport, is familiarity. Like, I think what people forget is that these guys' lives and women are really isolating. Like they are constantly worried about motives of people, friendships, like who can they trust, who just wants money from them. I'd hate to have my salary posted online, so I'm sure they hate that. Like they are constantly getting badgered by people wanting something from them. So I think like it took me a season and a half just to make myself like known that I was trustworthy and not there to tattle on them or tell the organization what issues they had. So I think it took a lot of time just to even get buy-in of like, this is a confidential resource.
Did you watch Ted Lasso?
I did.
Okay, remember how Ted would have these anxiety panic attacks? Mm-hmm. Is that a real thing? Like, have you had players have that? Like, how would you describe it? Gary, he's on the soccer field and he's the coach, and all of a sudden he just had to freeze up and leave, right?
Yeah.
Does that happen in real life?
I think typically it does happen in real life. I would say it's just situational. Like it may happen in the locker room before a game. I'm not saying that happens here. I've just heard that this happens, that, before a game is incredibly stressful or after a loss. I think typically during a game, people are pretty locked in and focused.
So after a game, you sometimes have to meet with a player? A player wants to meet with you at 11 o'clock at night because the game's over at 10:30.
I've had phone calls late in the evening just to talk about things or decompress, not just players, but people throughout an organization.
So they have access to you all day?
Yes.
Like they call you at 11 o'clock at night, you pick up?
Luckily, that doesn't happen too often. I think the latest call I've ever gotten, and it wasn't even related to sports, was 10:30.
Oh.
And I did pick up.
Like I was at the game the other night. It was like over at 10 and or some of those games start at 8 and they're over late. And I would think after, like my son had a scrimmage last week. Of course, he's in Hawaii, so he's 3 hours behind. But I went to bed, woke up in the morning. He was like, I played terrible. And he just got very emotional. And I wish I was there for him, but it was late. It was midnight or 1 o'clock. And then a half hour later, he's like, it's okay. I'm just going to have to work harder, is what he said, right? 45 minutes later. So I felt like if he had access to someone like you, or I feel bad I wasn't there to take it. But he was fine the next day. But sometimes I think, do they call you like that? Like they're driving home, man, I don't know, what did I do wrong?
So to me, I would see that almost like as a failure of my role if they needed to do that, because my goal is to give them the skills and the tools that they can kind of like process it themselves. And I feel like if they can't, I haven't done my job.
So get specific. What's something like what? Tell us like how. What's it? Something you give them a tool. What's a tool that we can give somebody watching this right now?
Yeah, I think some tools are like mindfulness kind of breathing exercises. So if someone is having a panic attack, they're now having physical manifestations of their anxiety, right? They're getting short of breath, palpitations. Sometimes they show up in the ER to their
Absolutely.
outpatient physician saying that I'm dying. And so one goal of like some biofeedback exercises of deep breathing, like box breathing, where you breathe in for 4 seconds, hold it for 4 seconds, breathe out for 4 seconds, is getting that
works.
physiological response to get your body to slow the F down because you are just really ramped up and hyped up and can't calm down. So I think just those kind of tools they should try and institute first before calling me, because we were talking about this the other day of like setting boundaries. So both her and I practice concierge medicine, and one of the questions I get a lot, and I'm sure you do too, is, oh, do you get called at 2 a.m.?
Always.
Yeah.
Everybody swears everybody must call me all night long because
Right.
they have my cell phone, and it's so not true.
Right. It is so not true. And I feel like our job to be good physicians is to give our patients tools to work through things themselves, whether it be for physical medicine or mental health care. And then if things are bad, of course, call us. But I think it would be a disservice to people if I was just like their lifeline that they needed to just call and I was the only fix, if that makes sense. Yeah.
I think the family members end up being the lifeline. So I wanted to ask you, do you also help with mental health for the family members? Is that part of the extension of your services?
I do, but in my private practice. So someone, of course, that's a family member is welcome to come see me. It's just done outside of the building in my own private practice.
Would you say that you've met with every player on the Suns?
I can't say for certain whether I have met with every player or not, but I will say that it is a requirement, just like physical health, to get clearance at the start of the season.
And how long is that session?
I can't say.
You can't say?
No, those are all way too specific.
Would you say that the players on the Phoenix Suns, if they saw you at a grocery store, they would know who you are?
Yeah, I mean, I would hope so. I'm at the practice facility like 3 days a week, so I would hope that they would know who I am.
But would they say hi to you, or are they not allowed to say hi to you?
I think they would say hi. Yeah,
So that means every player knows who you are.
but not because that's
Because
like
she sits in the cafeteria.
Yeah.
Where's that weird lady in the cafeteria over there?
Yeah, but for the first season and a half, I think it was like, who is she? Why is she here? And so it just takes time and buy-in.
What about for you? Like when the new owners came in, did you think you were secure, or did you go through anxiety going, oh man, they're getting rid of everybody?
That's a good question. I think I was more so focused on helping everyone else during the transition that I didn't really think about me. And I think the reason that I didn't think about that too is because I have a private practice and that wasn't my sole job.
Right.
Yeah.
Okay. But it's like sometimes I feel like in my career that there's a lot of parallels with basketball, with the NBA. It's kind of like with, I would assume players, do they get freaky or nervous about being traded? And if they do they come to you and they say, the rumors are they're going to trade me? Like I've heard rumors about my job and it makes me sick to my stomach. And my wife's like, that's not going to happen. Get it out of your head. You can't control that. Right?
Yeah. I would say like that there are certain peak times of anxiety throughout the season, playoffs, trade deadlines, all of that I think are high anxiety times just because of the uncertainty. But unfortunately, it's a part of the business. And I think people just know that they just hope to be playing somewhere. Yeah.
And have you ever been like, thank God they traded that guy?
I
guy was
really
a-
enjoy meeting every single person. I think they each bring a different flavor to the team, so I have not had that thought.
So you don't go to any but the coaches, that guy with number 25.
So we keep talking about the male players. Let's talk about the female players because you also work with the Phoenix Mercury. So do you see a big difference between WNBA, NBA?
Yeah, I'd say just on a broad scale, I feel like the WNBA is still getting accustomed to having mental health services because it was brought on a little bit later, I believe, than the NBA. I think 1 or 2 seasons later, if I can remember correctly. But I think that the gender dynamic is interesting. So I think some teams really vibe with a female mental health person. I think other teams prefer a male. It really depends on the team culture. So I think that's an interesting dynamic I've seen is like, I think sometimes the male players more like to seek a female provider versus the female players might prefer a male.
Do you think the stressors are the same between the two for gender dynamics, or do the women do they have a added level of stress the men don't have to carry?
I think there are different levels of stress. I think that there's a lot of viewers and people in attendance and sponsorship money at stake and things like that for the men on a smaller scale for the women. But I think that there's just different types of stressors because it almost throws me back to thinking of like 20 girls in a sorority in college. And I think that it can present difficulty and high tensions at times.
You know, I brought up Ted Lasso. He had a psychiatrist too. Remember? Mm-hmm. Is that what it's like? A session like the session he had?
I don't think so.
It's not like that.
I don't
It's
think
made
so.
for TV.
Yeah, it's made.
I
for
know,
TV.
but they make it seem like he comes in, sits down in her office, they talk. You know, he breaks down, cries a little bit, or he
Yeah.
gets up. Then he calls her every once in a while.
That would be if I had an office. I've had to get creative then there, and I use a patio. So a private patio with
Oh, that's
4
good.
chairs. Yeah.
Do you go on the trips with them when they play in another city?
A few times. Last season, I was traveling up until I hit about 34 weeks pregnant, and then I decided to stay home. So I traveled through January or December of last season. And then for this season, I just traveled for the preseason trip and the first regular season trip.
How important is sleep for mental health?
So important. I mean, for everyone. I think anywhere from pregnant women experiencing mental health crises that are trying to not precipitate a manic episode if they have a history of bipolar disorder, sleep is so protective, and same for athletes. Like your body needs to recover both physically and then your mind needs to recover mentally. So you need good sleep.
So what's a good amount of sleep?
I think it depends on the person. I think it's really difficult. Like I can probably thrive at about 7 hours of sleep, and my husband, up until he got his CPAP, needed like 9 to 10 hours of sleep.
I have CPAP.
Yeah.
So wait, was he snoring and keeping you up?
He was snoring, and then he would stop breathing, and then I thought he had narcolepsy because he was sleepy in the afternoons, and he had all of it. So
And how long has he had the CPAP?
he's had it now for 1.5 years, and it changed his life.
Right?
Yes.
I love my CPAP. Yeah. But does he get marks on his face? I got marks everywhere.
He has a nasal pillow.
Oh,
so it
I
just
can't
sits-
stand those.
Yeah.
Those
So
are
you have your own concoction.
Yeah, I do. I've
Marks on
rigged
your
up something,
face.
but I think I wish I would have focused more on sleep earlier in my career because I was working on 4 hours sleep.
Oh my
I
gosh.
just thought that was the way to do it. And up until I started training or working, having Carrie as be my doctor, where she told me to get the Aura Ring, and I became obsessed with monitoring my sleep. Now everybody in my family has the Aura Ring, and we compete to see who has better sleep.
My gosh.
It's great. And then it's like, you know, because you can see everybody's sleep. It's like, so what happened last night? And it was my roommate's birthday, and we went out, or I had to study for a final. So or my youngest son sneaks out to go see a girl. We're like, why is your sleep score a 70?
The Aura Ring outed him.
Yeah.
That's pretty cool.
Yeah, it's
So how much sleep do you get now after living at 4 hours?
Now I've pushed it 6.5, sometimes 7.
Okay.
Right? Which I wish I would have discovered this 15, 20 years ago. It's crazy. And I feel better, but I'm still shooting for 8. And I really, it's almost like
But eight's not a real number.
It's
We've
not?
talked about that. No, I mean, 8 is just, it's kind of that rumor that everybody needs to have 8 hours. And just like Brooke was saying, it's so dependent on the different individual, their chronotype and their sleep algorithm. So for some people, 4 hours is actually adequate. What we discovered with you is 4 hours was far from adequate.
Right.
For the rest and recovery, for the REM and the deep stage that you needed, it just didn't work.
Well, it's like so on no sleep, I was miserable, right? So now I'm trying to get a little bit more sleep, and we got stem cells. We went to Mexico and got stem cells, and I feel like I'm operating at a whole different level with stem cells, which I just can't imagine what I'd be like without stem cells and a little sleep. Do you know what I'm saying? I mean, it's crazy.
What did you notice the biggest difference with stem cells?
I just feel like I don't take naps anymore. Like I'm just moving all the time. I feel more creative.
Mental alertness
yeah.
versus physical
Yeah.
exhaustion. We experience mental exhaustion a lot of times in our careers, and the mental exhaustion actually is one of the things that you notice goes away, which is weird.
I
because
find
we're thinking
myself
it's
being,
physical.
because I'm getting better sleep, I find myself being like more kind to people, more willing to, I think I have resting bitch face. You know what I mean? So when I walk up and down the hallways at work, people would be like, oh, he's a jerk. And I'd be like, why would they say that? But I think it's because I was always so tired. So now I find myself working well with other departments at the radio station and other people.
Increased
And
tolerance.
that's a great way of putting it, because I used to be like,
Not have tolerance.
no, get out of here. Now I'm a little bit, boy, that's such a great way. Increase.
But one of the things we do notice after stem cells, because so many people who get stem cells also have aura ring tracking, and you can track with the Whoop. It's not just an aura exclusive deal, but we notice that their deep sleep and their REM sleep actually increases percentage wise. So if they traditionally sleep 6.5 hours, the percent of time spent in deep and REM sleep within that 6.5 hours increases. And that's one thing we see consistently across everyone.
Do you have an aura ring?
I don't.
Do you monitor your sleep?
I do not.
Do you tell the players to do that?
Well, I think that with the players, it's very important. So I have an 8-month-old, so I think it is not helpful to monitor my sleep right now. But I will say she's a rock star. She started sleeping through the night at 4 months. So I now know, like, basically my alarm's going to go off at 6. So I just backtrack and try and go to bed at 10.
Does she have an aura ring?
Not yet.
Will you leave the show today and get an aura ring?
I think I've been very interested in monitoring, so I think I could see myself using something like the Whoop more instead of a ring. But yeah, I think the tracking is very helpful, and it gives someone some good data who might not put the pieces together about how much sleep they're actually getting. Another big thing to consider too, if someone says they're having a hard time sleeping, is to ask about naps. Because one time I remember just in my office, I asked someone about, like, they're like, oh, I'm having so much trouble sleeping. I get like 3 hours of sleep at night. I'm like, well, do you take naps? And they're like, yeah, I nap about 4 hours a day.
Exactly.
I'm like, well, that's the problem.
Right? I try to tell my wife that. She'll go take a nap. And she's like, I'm going to nap for as long as I can. I go, I'm going for 10 minutes. And she's like, no, you got to. And she'll sleep for 4 hours.
Oh, my gosh.
Right? But then she'll go back to sleep again. Like, I think it's the stem cells, too. She got some stem cells, too. What about recovery? And you brought up cold plunges and all that stuff. Where does that fall in the mental health world?
Well, I think that there's some, good evidence that it could help with mental recovery as well as physical recovery. Just helping people with their overall mood, and the dopamine and norepinephrine surge can help with mood overall.
But so the cold plunge, have you seen all this stuff about the cold plunge? They say it's the same dopamine as doing cocaine. Have you seen that?
No, I haven't seen that.
I've heard that.
Is that real or is that not real?
Well, I think that it boosts that reward system, like the dopamine that is, like with THC, it activates, and other drugs, it activates the reward system. I can't say I know scientifically that that's true, but I do know that people that do use cold plunge and get up to their neckline with the vagus nerve kind of being activated do have mental benefits from it.
What's your take on, since you're a psychiatrist, but also a child psychiatrist, family psychiatrist, this whole thing with vaping right now, right? It's everywhere.
Yes.
And teens are doing it like crazy.
Yeah. Yeah, and it looks so subtle too. Like I had someone tell me that they found something that looked like a bookmark or a USB plug, and they opened it and it was a vape pen. It's like terrifying how easy it is to hide and how discreet it can be.
And I've seen, do athletes vape?
I don't
must.
think they would want to tell me much about
Oh,
it
that's
if
true.
they
Because
do.
I think they vape the weed too. Like
Yeah,
they're-
you can vape.
Right.
Yeah, marijuana.
But that's the thing, the marijuana and the vaping and the drinking. It's like I always use Devin Booker as an example to my kids because there's this interview I saw with him where he talks about he didn't go to prom, he didn't go to homecoming, he didn't have a lot of friends. He played basketball and he trained. He trained with his team called the Alabama Challenge. And I always tell my son if he's going to go to a party or something, I go, hey, man, Alabama Challenge. Alabama Challenge. Get back in here, get some sleep, and train, and train, and train. And that's what that book, Mind Gym, talks about, the different mindset you have to be, there's what everybody else does, and then you have to be better, right?
Yeah, there's
So-
a push to be the best. You have to work hard and eliminate all the distractions and eliminate all the noise. And you could argue maybe that, that players that are out there partying, staying up late, drinking, drugging, whatever, they are going to have severe impacts on their performance because they're not going to get that restful sleep and recovery.
So Carrie had a patient that I met, and he was a wonderful guy, and he was very open about his health because I know you can't talk about stuff, but he was like, "Ask me anything," and then we
Right,
did it. We
open
did
book.
it. Yeah, right.
Yeah.
Anything. He had heart problems. He had all kinds of stuff. He's like, "Talk about anything." And I kind of feel the same way. Like I'm willing to talk about anything if I can help somebody. Now, is there ever been a patient of yours or an athlete of yours that has had the same thing that you can talk about?
Unfortunately, not.
Like you can't
No.
say, "Oh, I sat down with Charles Barkley. You know what he said?" There's nothing like that.
No, unfortunately, I can't.
Dang.
I know.
But is there anybody, have you had a player, though, that you were like, they had some serious concerns? Or is this stuff that's textbook that you can handle?
Yeah,
Not
I
that
think
you can't handle anything, but I mean,
Yeah, I think that there's definitely clinical things that come up in sports, and I think that's the thing people need to understand is that athletes aren't perfect. They're not superheroes. They have clinical concerns. They can have general anxiety. They can have major depression. Just because someone's a star player doesn't mean that they don't have things going on off the court. And so I think that's the thing a lot of fans miss is that they treat these players like assets, right? And they don't treat them as actual human beings. And, I think just witnessing the almost like heckling and name calling and like, you must sign my t-shirt and like yelling at them as if they're things is really, really hard for them. I'm
and then
sure.
if they don't, it's like they signed 75 T-shirts. But the 76th one, they got to go.
Right.
And that one person says they're a jerk, they're whatever, because they didn't sign it. But at some point, it's got to stop.
Right.
Now, have you had a meeting with a player where you're helping them, it is what it is, but you kind of, in your mind, you're like, I can't believe, if the world knew that this superstar player had this question or that they have this insecurity, it's like, what I'm asking, I guess, is that some sort of peace of mind that sometimes these mega players are human like us and they have the same insecurities that we have.
Well, I think that that's true with all high performers and achievers, like corporate executives that are high up in their positions, athletes, like everyone, every single person has some sort of insecurity about themselves, or what like I clinically call a cognitive distortion, where it's like something in your mind, like a cognitive distortion, for example, is like fortune telling. So it's like let's say before I walk in to record this podcast, I'm like, I know I'm going to suck. He's going to hate me. I'm going to totally ruin this show. That's a cognitive distortion. Everyone has some type of cognitive distortion. It just plays out differently for different people. So I think that everyone has something that is a deep insecurity to them.
But you're saying, so if you go into the mindset like of this podcast that we're going to hate you, it's going to be terrible, then using that manifestation, it could turn out that way. But if you go in with a more positive outlook, right? Man, this is going to be great. I'm going to have the best podcast in the world. This is going to be like that. Doesn't that change the vibe?
A little bit. So this is all of the premise of cognitive behavioral therapy, or CBT, is like, how does an automatic thought impact your emotion, which then impacts your behavior, right? So like if I had that automatic thought, then I could use some CBT skills on myself and be like, well, out of the last 15 podcasts you did, how many of them were absolutely horrible and they said you sucked? Well, 0. And then you start to rationalize and use that logic. So then the emotion then is not feeling bad and then sucking in the podcast. It's going to be like feeling hopeful or optimistic, and it's going to lead to feeling hopefully good overall about it.
What about with these elite players that you deal with? Do you see a common denominator with them? I have a couple friends. One is a World Series champion. Another one is a World Super Bowl champion. And they have there's just something different about them when they compete. Even if it's a board game, like they want to kill you, right? Now, is that a common trait with champions?
You mean the kind of just super competitive mentality?
Yeah, there's just something different about them. I can't place it exactly, but there is a different operating system with these guys.
I don't think so. I think everyone brings their own flavor, which makes each team each year very interesting. Some people are just really kind, nice people that, get ready quietly and go out on the court and smile at people, whereas other ones are like locked in and serious looking and, look like very scary when they're out there. So, I think that it just is really dependent on the person. But that doesn't mean they achieve differently, I think is the point.
What about rituals or OCD behaviors? Do a lot of players have that?
Yeah, so in the sports psychiatry training, they actually have a whole kind of module on ritualistic behaviors. And that's not OCD, right? Because the difference between like rituals and OCD is that it causes dysfunction to your daily life.
OCD does.
OCD does.
Right,
so
okay.
That would be like if I had to wash my hands 200 times a day, that probably gets in the way of me functioning in my day-to-day life versus if, before, let's say if I'm an athlete and I go out on the court, which I think I'm not very athletically talented, but that would be like maybe tying my shoe in a certain order, watching a video, listening to the same song. Like those are all rituals, but not necessarily OCD because it doesn't cause dysfunction.
Well, that's good to know. Because,
Rituals are positive.
Yeah, because
Yeah.
I have then a shit ton of rituals. So I always thought it was OCD stuff, man. It freaked me out. What about medication? Like, what's your take on the Vyvanse and what's the other one? Adderall. and all that?
Adderall, we've got a whole bunch of different stimulants out there.
Yeah, so I think that in people with true ADHD that they can be life-changing, but the thing to always screen for and be aware of is, are you also using marijuana? Because if someone's using cannabis, it can actually precipitate like psychotic paranoia, hallucinations, and it can be really dangerous. So I've seen that throughout my child psychiatry training is kids coming in after using some sort of like a wax pen or some really like strong cannabis, and then it kind of pushes them over the edge into psychosis. So I think, the ADHD medications have real utility if they're not using marijuana and they actually have a diagnosis of ADHD.
Yeah, are there players that take ADHD medicine?
So in the league, there's definitely players with ADHD, but there's certain protocols that throughout the league, if a player has ADHD, you have to submit the appropriate documentation because they will fail a urine drug test, and so you want to kind of get ahead of that.
Stuff that med comes in a urine test, like
Yeah, because it's an amphetamine.
Oh,
Yeah.
I was talking to you earlier about the new trainer at the Suns, who I know, Keegan, right? Does that position, like is it a trainer? What do you call it? What he does? He's the guy
Athletic
the PT
trainer.
guy, athletic trainer. Do they come to you and go, hey, so-and-so tore his ACL, he's 6 months out. Can you talk to him? Like, do they do that? Or does a coach or somebody ever come up to you and go, can you talk to so-and-so about whatever? I think they're feeling a little down or...
Yeah, I think in generalities, what I could speak to is that there are like department meetings, and in those meetings, it's discussed like what the injury updates are.
What about management and ownership? Do you talk to those guys, or is it just players?
In terms of just talking to them, yes, I interact with.
Therapy sessions, client.
I
patient.
can have sessions with anyone in the organization, so I can say that.
Really? So even the person that's ripping the ticket, if they want to talk to you?
So anyone that's at the practice facility,
Okay.
so that's really like basketball ops.
Do you ever use any of the things at the practice facility?
In terms of for myself?
Yeah, like
You're
the
asking
cryo
if she
machine.
shoots hoops?
No, like I heard that there's a cryo machine in the back that no one even knew about forever. And then they started using that, and I think they got the ice baths and all that stuff.
Okay, yeah, if that's all in the male locker room, then
it is?
I don't have access to that.
Oh, so you don't go in there and lift weights, so you don't go in there and...
No, I probably wouldn't want to be walking around in my bathing suit over there.
Is that how you
in
lift
my
weights?
workplace? In the cold plunge.
Well, good. This has been very cool, right?
Yeah,
Been cool.
okay.
Anything else we need to bring up, Carrie? I'm fascinated with all. You should, in my opinion, check out that book, Mind Gym.
Okay, I
Because
will.
I think it is. I've listened to it. I've read it twice. I listen to it as much as I can with my kids because it's just so great. So I was trying to track the guy down to get him on my show to interview him because I was just blown away. Because it's also old enough to where I feel it's a secret weapon. You know what I mean? Like not everyone's doing that now. And it also, he name drops everybody that he works with from the Cardinals, the famous baseball, and it's at that point where you might know some of the players, you might not. Like, I'm not a sports guy. I mean, I'm turning into one now because of my 3 boys. But back then, oh yeah, I remember that guy's name. I remember so and so. You know, so it's kind of neat. And they get specific how he helped them manifest and project stuff. See, what you put out in the universe comes back. Do you believe that?
Yeah, I think so. I totally believe in that. One other book I recommend to everyone is Atomic Habits. That book is fantastic.
My son, who I had read Mind Gym with me, he told us to read Atomic Habits.
It's great.
What are other books that you like?
Flow state. So any books on maintaining like a flow state are really, I'm super into right now. I'm reading a lot about flow state and just how can you get in the zone. Another one called like deep work. I love that term is like, so if I don't want to be bothered and my husband comes in, I'm like actively working. I'm like, deep work, honey, deep work.
Oh, deep work.
So I love,
It's a new code word.
Yeah, I love books that are talking about like how to really enhance your performance and get in the zone.
Okay, so for my son who plays basketball in Hawaii, I should tell him to get deep work.
And Atomic Habits.
He already read that one.
Okay.
And what was the other one you used?
Flow state.
That's the name of the book, Flow State?
Yes, I believe so. It has a light blue cover.
What's your favorite TV show?
That's so hard. Right now, it's The Golden Bachelor.
For real?
She's dissecting that apart from a
And
psychiatry standpoint.
Morning Report with Jennifer Aniston.
Morning Show.
Morning show, yeah.
You know what? I started watching season 3, and the first episode bothered me.
Really?
I couldn't get. It just seemed so. I forget what it was. It was so silly almost. Oh, she's going into space.
Oh, yes,
And I was
yes.
like, come on.
It does get better from there.
Oh,
I
it
will
does?
say,
Because I was like,
yeah.
I can't. This is silly.
What's your favorite TV show?
I'm watching. It's called Generation V, Gen V.
Oh, yes.
That's
I'm
on.
watching that.
I'm watching that. I just finished a movie called Painkillers or Pain Hustlers.
Pain
There-
Hustlers, which is different. Yes.
There's Painkiller,
Mm-hmm.
and then there's what's the one? Same thing. It was the doc. I told you. It won all these awards on Hulu. It was all about the opioid crisis. It was.
Oh, I know. I see the cover in my mind. I know what you're talking about.
That was with the guy that played Batman, Michael Keaton, and then they did another one called Painkillers, and that's with the guy that played Ferris Bueller.
Correct.
And then
Yeah.
this came out, and this is the guy that plays Captain America, and it's a true story about the pharmaceutical companies, but it's fentanyl, and that's in 6 months they were making hundreds of millions of dollars, and now all the people are in prison. That's number 1 on Netflix right now.
Okay, I'll
Pain
check it out.
Hustlers, yeah. But good. What about you, Carrie? What are you watching?
I'm
What are you reading?
not. Well, I read medical journals every day, so that doesn't really count. It's like an endless.
She knows more about anything than anybody I've ever met in my entire
But what
life.
I'm kind of a history buff, so I'm actually rewatching Band of Brothers.
Oh yeah, that
It's
just came out
so
on
old
Netflix,
school,
didn't it?
I know.
Or Max. Yeah.
Yeah, yeah.
But that's
Very
why
old
she's
school.
good at what she does. She's constantly reading.
Oh, I know.
Yeah.
Like you don't. Like normally, I'll Google something. She's a human Google in the medical world. Yeah. Well, thank you for your time and
Thank
jumping
you.
on our podcast.
Appreciate it.
Yeah. Very nice. Thanks.